हेलो। ये कौन सा ईयरफोन सुनता है यार, एक तो खराब है इसमें। हेलो हेलो हेलो, कैन यू हियर मी? कैन यू हियर मी? हेलो
Yes, ma'am.
हेलो। Okay. Today's class I'll be taking on extraoral radiographic examinations on extraoral radiographs. Okay. There are different radiographs that I can take intraoral and extraoral differ by its name itself. Intraoral means we place the film inside the mouth, and extraoral means the cassette is out of the mouth or the extraoral placement. Okay. There are different radiographs that are taken. The lateral cephalo, one is the OPG, okay. Then the lateral cephalometric projection, the submental vertex, Waters projection, PS sub, okay, or posterior anterior cephalometric projection, reverse down projection, that is open mouth, mandibular oblique lateral projection, that includes two radiographs, that is mandibular poly and the mandibular ramus. Coming to lateral ceph, okay, this is especially used in the department of orthodontics or is also known as the lateral skull projection. Here we get even the soft tissue landmarks such as the lips, nose, okay. So the way in this chapter I'm going to explain where is the image receptor, that is the film and the cassette. The film is placed inside the cassette, okay. That is placed on which side and how it should be placed, and from where does the central ray go through, the point of entry of the central ray of the X-ray beam, okay. Image receptor is positioned parallel to the patient's mid-sagittal. This is the mid-sagittal plane, okay. So it's placed parallel to the mid-sagittal plane. Site of interest is towards the image receptor to lessen the distortion. There is a wedge filter. I said there is a soft tissue recordings done on this. So for that, we need a wedge filter as the tube head is positioned over the anterior aspect of the beam to absorb some of the radiations. It absorbs some of the radiation, मतलब इतने hard radiations नहीं होते. So this will allow visualization of the soft tissues of the face. Coming to the position of central X-ray beam, the central beam, the cassette is placed here, okay, on the left side, and it is, yeah, it's placed on the left side of the face, okay. It should be parallel to the mid-sagittal plane. The central ray will come from the right side, and it has to be, it comes this side, okay. So it is perpendicular to the mid-sagittal plane of the patient and also to the plane of the image receptor, and this central ray should center over the external auditory meatus through here, and the resultant image, we usually get the exact superimposition of the images, okay, and the right and the left side. But here there is some amount of discrepancy in exact superimposition because the sides that are near to the image receptor magnified less, means the right side and the left side structures will be cast, right? So the structures, that means the left side structures are close to the image receptor than the right side structures. So these are less magnified and this side structures are a bit more magnified. Okay, so there is some amount of exact superimposition is not possible. There is some amount of magnification, and the structures which are close to the mid sagittal structure, मतलब अब जैसे जैसे ये जाओगे mid sagittal पे the structures, they are nearly superimposed, मतलब almost same रहते हैं. जैसे जैसे mid sagittal structure से दूर जाते हैं वैसे वैसे magnification होता है. Example includes the planar process. This is the placement. Here you have the patient. This is a mid-sagittal plane. You have the image receptor, that is the film and the cassette, and then you have the to stabilize the patient. Okay, there is a waste filter because of which the soft tissues are visible here, and we have the skull image seen on the resultant radiograph. Submento vertex projection. As the name suggests, it is a submento. The central ray goes through the submento and comes out of the vertex. The image receptor and patient placement. How should they be? The receptor is positioned parallel. The receptor is definitely behind on the vertex because the radiation goes from submento and it comes out through vertex, so it's placed backside. Receptor is positioned. So the patient will be something like this. Patient is receptor is positioned parallel to the patient's transverse plane and is perpendicular to the mid sagittal plane. So ऐसा हो जाता है. So the patient, it should be perpendicular to the mid sagittal plane and the coronal planes. Patient neck is extended as far backwards as possible with the cantomeatal line forming a 10-degree angle with the receptor. Central beam is perpendicular to the receptor. It's always perpendicular to the receptor, directed from below the mandible towards the vertex of skull and centered about 2 centimeter anterior to the line connecting right and left condyles. जब ऐसे हो जाएंगे, we have to imagine the right and the left condyles and a line passing through it. From that imaginary line, 2 centimeter anterior. Okay. So this is how the patient is positioned. His neck is extended as back as possible. It is placed here parallel to the coronal plane and transverse plane, and the central ray goes from here. You can see that this is a condylar region. So the imaginary line there, 2 centimeter in front of that, that means from the chin area it goes, and this is the shadow that is formed or the resultant radiograph showing the mandible and the base of the skull. In another video, in another image we have where only the whatever parameters, extra parameters we keep, that is kept a bit this one. So in that, it's called the jug handle view. In that only the zygomatic arches can be seen, that especially for the to view the fractures of the zygomatic arch. Okay, and others all parameters or the other all structures um, will not cast a proper shadow there. Okay, so resultant images mid sagittal plane, the mid sagittal plane whatever is there, it should divide the skull into two symmetrical halves. Buccal and the lingual cortical plate जो है of mandible should be projected as uniform opaque plates here. And underexposed view, that is the parameters of the X-rays are kept low for evaluation of zygomatic arches. Okay, as they will be overexposed. जब overexposed करेंगे, parameters ज़्यादा रखेंगे और burned out on radiographs obtained with normal exposure parameters. Coming to Waters projection, Waters projection is nothing but paranasal sinus projection, where all the sinuses are seen, the frontal, the ethmoid, the sinus, and the sphenoidal sinus here on the palate. Okay, so when the mouth is open, it is seen on the palate. This is the paranasal, this is the frontal, and here comes the ethmoid sinus. Image receptor and patient placement. Here you can see in this image, this is the image receptor and the central ray comes from here. Image receptor is placed in front of the patient and perpendicular to the mid sagittal plane. This is a mid sagittal plane here. It is perpendicular to both. The patient's head is tilted upwards, okay, so that the cantomeatal line, the canthus, ear canthus, and the cantomeatal line forms a 37-degree. Okay, this forms this with the receptor and the cantomeatal line, canthus and the meatus, eye to the ear. Okay, this angle forms 30 degree, 37 degrees with the receptor. If patient's mouth is open, the sphenoid sinus will be seen superimposed over palate, central ray. हाँ भेज दो. Just a minute. Sorry to disturb. Yeah. If patient's mouth is open, sphenoid sinus will be seen superimposed over the palate. Central beam is perpendicular to the receptor and centered in the area of the maxilla. It should go through the center of the maxillary sinus. Resultant image, you will get again two symmetrical halves. The skull image will be two symmetrical halves. The petrous ridge of the temporal bone should be projected below the floor of the maxillary sinus. Okay. Coming to the posterior anterior cephalometric projection, that is the PSF skull. PSF, this is a PSF, the patient stands straight, the cantomeatal line is here, and you have the film placed here. The patient will touch his nose and the chin. I'll tell you. Image receptor and patient placement. Receptor is placed in front of the patient, perpendicular to the mid sagittal plane. This is the mid sagittal plane. Okay, that is perpendicular. and parallel to the coronal plane. Coronal plane is this. Okay. Patient is placed so that canthomyatal line forms a 10-degree angle with the horizontal plane and Frankfurt plane is perpendicular to the receptor. In PS skull projection, canthomyatal line is perpendicular to image receptor. The central ray is perpendicular to the receptor, okay, perpendicular to the coronal plane and directed from posterior to anterior. It is PS skull. Posterior to anterior, parallel to the mid-sagittal plane and centered at the level of the bridge of the nose. At this point, the central ray should pass. Next, the resultant image again here, the skull is divided into two symmetric halves and superior border of petrous ridge should lie in the lower third of the orbital. Reverse down projection. Reverse down, this is the position. Okay, the patient's forehead will touch and the receptor is placed in front of the patient. The patient is asked to open the mouth and the canthomyatal line will form a degree. Okay. Image receptor and patient placement. Receptor is placed in front of the patient perpendicular to the mid-sagittal plane. Mid-sagittal plane, this one, and parallel to the coronal plane. Patient's head is tilted downwards so that the canthomyatal line forms a 25 to 30 degree angle with the image receptor. To improve visualization of the condyles, patient's mouth is opened. यहाँ पे especially in reverse down we see for the condylar injuries, okay, condylar and the body, the ramus that we'll see. So here to improve visualization of the condyles, patient mouth is open और patient को बोलते हैं जितना हो सकता है वो उतना open करने को, so that the condylar heads are located inferior to the article eminence. Eminence के अंदर आते हैं तो you can't see the eminence fracture. I mean you can't see the condylar head fracture. So जब वो ज़्यादा open करेंगे तो condylar head will come anterior to the inferior to the articular eminence. Central ray is perpendicular to the image receptor and parallel to the patient's mid-sagittal plane at the level of the condyles through here. Okay. Resultant image, mid-sagittal plane should divide the skull image into two symmetric halves. Petrous ridge of temporal bone should be superimposed at the inferior part of the occipital bone and the condylar head should be projected inferior to articular eminence. Coming to mandibular oblique lateral projection. Mandibular body and you have mandibular ramus. दो है इसमें. Coming to mandibular body projection. Mandibular body projection, that is till the molar region. Okay, one will be that and the second will be the ramus projection. Mandibular body projection, image receptor and patient placement. Usually हम cassette अगर right side ले रहे हैं तो left side cassette देते हैं and we ask the patient to tilt so that both the mandible should not overlap. Okay, image receptor and patient placement. Receptor is placed against the patient's cheek on the side of interest. अगर ये वाला चाहिए लेफ्ट वाला, अगर आपका रे आ रहा है राइट साइड से तो you place it against the cheek or the side of interest and centered. The cassette should be centered at the molar premolar region here. And this lower border of the cassette जो है, it should not be exactly here. It should be 2 centimeters below the inferior border of the mandible. So you should cover that. The head is tilted towards the side being examined, left layer to the left side, and mandible is protruded. आगे लेना है. Okay. Central ray is directed towards the molar premolar region from a point 2 centimeter below the angle of the opposite side of mandible. ये angle है ना, यहाँ के 2 centimeter below से ऐसे लेते पीछे से. Okay, for this we take it. And resultant image, actually it should show a clear image of teeth, alveolar ridge and body should be obtained. I'll show you the image. Yeah, this is the image where you have can see one reverse also. Okay, but actually you need to see the teeth, the alveolar ridge and the body. Okay. Mandibular ramus projection. Why we need ask the patient to tilt? Because you have देख सकते हैं ऊपर this mandibular floor that is of the this side from where the X-ray has come. Okay. Coming to the mandibular ramus projection. Ramus projection भी ऐसे ही है. If you taking the ramus, just place behind, and the projection will be through the first molar. Okay. A receptor is placed over the ramus and has far posteriorly to include the condyle also. Lower part of the cassette is parallel and again 2 centimeter below the inferior border of mandible. Head is tilted towards the side being examined such that the condyle of the area of interest and the contralateral mandible angle दे फॉर्म बोथ फॉर्म ऑफ हॉरिजॉन्टल प्लेन, मतलब इतना टिल्ट करना है कि एक कॉन्डाइल और ये जो एंगल है आपका दूसरी तरफ का, ये दोनों पैरेलल एक लाइन में आना है. ओके, या एंड देन द मैंडिबल इज प्रोट्रूडेड अगेन. इतना टिल्टिंग इसलिए होता है क्योंकि कॉन्डाइल दिखना है. सेंट्रल बीम, central ray beam is directed towards the center of the imaged ramus from 2 centimeter below the inferior part of opposite side of mandible